Why don't you tell me your first name and why you're here?
Sue, and I'm here because I support health care for all, and it's just a Christian thing to do. I was lucky I had health care insurance, and everybody should have the same right. That's it.
Hi, my name is Nancy James. I have a family history of breast cancer. I have been unemployed for 3 years, and I have no health insurance coverage. It should not be coordinated and dependent on employment. We should have preventive care. I haven't had a mammogram in 3 years. The last one I had to pay for myself. It was over $300. That's prohibitive. We need preventive care to keep health care costs down.
Okay, my name is Robin. I'm from Detroit, Michigan. I am a child care provider for the state of Michigan. I get paid $1.66 an hour. There is no way I can afford health insurance. And with this being passed, I'll be able to go to the doctor when I get sick, because when I take care of children, if they come in with colds, I catch a cold. And there's no way I can afford to go to the doctor to get care for myself. But I still have to continue to work and do what I do, and I do this 7 days a week.
All right? Go ahead.
Yeah, I'm here because I believe in health care reform. I think it should be available to everybody. I have good health care, and it's not like I'm looking for anything. I would probably keep my health care, but everybody should have a public option, and we're a shame in the face of the world that our people can't have good health care. And that's why we all need it, we all should have it, and it's way past due. Thank you.
Thank you so much. I am proud that Jackson has demonstrated that people can gather peacefully, civilly, and exercise their right to speak about what they care about. Thank you for that. I just want to make a couple of brief comments, and I'm overwhelmed by the turnout here. You are here speaking for those families, those parents that don't have insurance, that go to sleep at night worried that their child doesn't get sick because they won't be able to take them to the doctor. You are here speaking for those families who are seeing their out-of-pocket medical costs go up and up and up. And of course you know that healthcare is a leading cause, healthcare costs are the leading cause of bankruptcy in our country. I am proud that you are here speaking for businesses that are seeing their premiums go up by double-digit increases every year and are having to choose between keeping people working or paying for health care. And I'm proud that you're here speaking for senior citizens. Need us to keep our promise of health care, and frankly, I don't think we're doing a very good job of that, as millions of seniors fall within the donut hole every year, and we can fix that. I just want to conclude by saying that I haven't committed to voting for any particular bill yet. I need to see what the final bill looks like, but if it meets those principles, then I will support fixing our broken healthcare system in this country. And I will finally say that I thank you for being the conscience of this nation. This is one of those moments moments in our history where we have to look at what we stand for as a nation. Now, folks may ask, what's the rush? Well, go back and look at history when Teddy Roosevelt in 1912 challenged this nation to make sure that everyone could afford quality health care. Ask Harry Truman in 1948 when he challenged the Congress to solve our nation's health care problem. And, you know, it's okay. The mistruths, the misinformation that are being perpetuated are the same attacks that were made in 1965 when Medicare was established in this country. So, thank you for being here. Thanks all of you for being here, exhibiting your First Amendment right to speak your mind in a peaceable way. There is important work for all of us to do. This is the time for all of us to be activists, to be involved. And I pledge I will continue to listen to you and take back to Washington what I hear, and I hope we can solve this problem in a way that makes our country stronger, that doesn't add to the deficit, and make sure that everyone has access to quality, affordable health care. Thank you so much.
I'm at this rally because I believe that our country has a moral obligation to help its citizens who contribute to it already through their tax dollars to cover the healthcare needs of everyone. We have the resources and we should use it to cover everyone. We shouldn't have people going to the ER for their primary care. We should have them going to a primary care doctor, staying healthy, and staying out of the ER where it's the most expensive kind of care. We should make sure that the administrative costs for any healthcare program are minimized so that all of the dollars for healthcare go to actual care for people who need it.
Go ahead.
Hi, I'm Linda Henderson, and I'm here to support the health care reform bill. I'm very impressed with the amount of civility that a lot of these people who are running the town hall meetings have dealt with this reactionary behavior by what appears to be a paid-for campaign to shut down the reform legislation. And I'm here to show my support on the other side of that equation. I believe it's absolutely necessary, especially in the healthcare industry. I think that's a unique area in which people are the most vulnerable. And I can tell you as a lawyer and just as an individual, most people know this, that there are people who are just desperate right now because they're getting their, even when they pay for their insurance policies from the private insurance companies, they're getting denied, you know, in the worst circumstances, you know, possible, losing their houses. You know, they pay people to find ways to deny their claims. So you're not even just talking about the people that aren't insured at all. You're talking about people who are insured that aren't being properly taken care of by insurance companies. And you know, they can say, oh, well, that's going to change or we'll do differently, but they've had years to change it, and they haven't done it willingly. Corporations, their mandate is their bottom line in a situation like this. So they have an obligation to their stockholders. They don't have an obligation to the public. The government does. And the reason why I support a public plan, I even support single payer, is that that's one place where I have some control. If I'm not a stockholder, I don't have any control over what an insurance company does. That's the board of directors does all that. And you're basically at the mercy of them. If you're a citizen, and if you're an active citizen, doing what we're supposed to be doing as citizens, then we can hold people accountable at the poll and at the voting booth. And so we really have more control when the government's involved, not less. So,
would you repeat that?
We really have more control when the government is involved, not less, because we, the people, can hold them accountable at the voting booth. Whereas, you cannot hold the insurance companies accountable. You don't have any power over them. And I think it's been pretty clear to people that they don't. That's why they're losing their houses, and that's why they're losing their lives. It's time for a change. It's time to grow up and get beyond all the rhetoric and do the right thing